If you're thinking about doing a facelift, I want to give you some information in general so that when you come in for a consultation, you'll understand sort of the background and the basics so that we could specifically focus on your particular problems. So let's talk about it. So facial aging has 4 components to it. 3 of them we can do something about. One of them is skeletal reabsorption, which we really can't do much about except for keep our dental hygiene and keep all our teeth, because that support structure in our skeleton is really important, and if you start to lose things, you can get hollowed out and aged looking. But short of that, there's not much that we can do in the field of plastic surgery or dermatology to help that. But the other 3 things we can, and I like to put them in 2 sort of categories. One is your skin, the quality of your skin, meaning the tone and the texture, fine lines and wrinkles, age spots, broken blood vessels, enlarged pores. All of those things, when they get to be aged, it does give the overall impression of an aged face. So the quality of your skin is very important in giving the overall impression of youth. The other 2 things, though, that give the impression of the aged appearance are, number 1, sagging of tissues, and number 2, volume loss. So the sagging of tissues happens when your skin gets stretchy, loses its elasticity. The support structures that live in 4 different places along your face start to lengthen and lose their elasticity. And the volume of your face actually starts to atrophy. So the fat pockets that are in your cheeks and around areas that keep things full and youthful actually start to shrink. And with the descent of the tissues that happen with that overall stretching, the fat pockets will not only atrophy, but will also start to descend. When that happens, you get a hollowing out under your eyes. You get an overhang of your nasolabial folds. You get a depression along your lower lips called marionette lines. Your jowls start to appear. And then you may have any degree of redundancy of the neck. So instead of having a 90-degree angle of the neck, you have an obtuse sloped neck, which gives the appearance of either being overweight or aged. So those things we can fix with any number of different treatment modalities that we can talk about here. So let's talk a little bit about facelift, though, because anytime there is sagging of the skin or redundancy of the skin of the neck, really the best way to treat that is with a lower face and neck lift. So a lower face and neck lift corrects from the mid-face here, just below the lower eyelids, and in some cases we'll even have some correction of the lower eyelids, but from the lower eyelids down to the clavicles. So that would encompass a lower face and neck lift. And you probably hear all around about different types of facelift. Like you may have heard of celebrity lifts or 24-hour lifts or lifetime lifts. These are all just marketing gimmicks to describe different types of facelifts. But when we go to meetings as plastic surgeons, we really don't talk about those things. What we talk about is the SMAS layer and what we do with it. So let me tell you a little bit about the SMAS layer. The SMAS layer is the superficial musculoaponeurotic system. It is a fibrous layer of tissue that goes between your skin and the muscles of facial expression. And it's a fibrous layer. It's less elastic than the skin, so it will hold a stitch and will have a long-term effect on anything that we do to it. So 100 years ago when they started doing facelifts, it was a removal of a small bit of skin. But the problem with that is skin is very elastic, so you could take a little bit out and it'll look good for a short period of time. But then as the tissue relaxes, it'll just recur. So then you go back for another little bit of skin removal and then another and another. And then before you know it, you have a windswept look because you haven't really corrected the problem at its origin. In the 70s, it was discovered that there was that layer underneath the skin called SMAS. And that is a more fibrous layer that will hold the stitch and hold the position of the tissue much better than just taking out a little ellipse of skin. So when plastic surgeons talk about facelift surgery, we usually talk about what we are doing to the SMAS layer. So some surgeons take that, they will lift the skin up to about this level on the face, and then they'll find the SMAS layer and sew it to itself. So that's called a SMAS plication or an imbrication. Or they'll take a little segment of the SMAS out and sew up the intervening segment. And that's called a SMAS lift. And I think that the lunchtime lifts and the 24-hour lifts and all celebrity lifts, are all of those types of marketing terms refer to any of those SMAS lifts where it's just sort of sewn to itself. And that type of facelift is effective, particularly more in younger people who don't have a lot of laxity and fullness in the neck, who don't have a lot of redundancy in the retaining ligaments along the face. So they don't need to be loosened and redraped. You may have heard about a deep plane lift, and that's the type of facelift that I do. And the difference between it and a SMAS lift is that in a SMAS lift, you never go underneath that layer and smooth it out. You never divide the retaining ligaments that support the face along its length into the neck. So in a deep plane lift, you make an incision in that SMAS layer and you go underneath it to divide all the retaining ligaments that exist along the face down into the neck. And when you do that, you are eliminating any redundancy that's sort of happened through the aging process. So I like to give the example, if you're making a bed and you pull the sheet up from the center, everything out on the sides will get wrinkly and may have strange looking effects to it. And I think of the deep plane lift sort of remedying that. Instead of going and just pulling around those retaining ligaments, you're actually going, releasing them, and then smoothing the SMAS out as one unit. And you rotate it in the direction where you can really get a chiseled jawline. Also, in a deep plane lift, oftentimes an incision is made underneath the chin, and the deep structures of the neck are addressed. This is particularly important in people who have heavy necks. So if there's a lot of fatty tissue in the neck, if there's a prolapse of the submandibular glands in the neck, these can be addressed through an incision under the neck, and the muscle in the neck can be tightened from the midline and then pulled back with that deep plane lift to really get a very nice and chiseled jawline with a 90-degree angle on profile and a really natural, beautiful, enduring result. People often ask about recovery for facelift. And of course, I'll make some generalizations, and everybody is a little bit different in the way that they heal. Most people feel comfortable going out into the public after about 2 weeks. The bruising, most of the swelling has somewhat subsided by 2 weeks. So going out to a restaurant or to the grocery store where nobody knows you tends to feel a little bit more comfortable after 2 weeks. I would caution you that the people who do know you very well will still feel like you look a little bit odd at that point. So people who have an important event or are going to take pictures or go on an important vacation or have a wedding or something like that, I would encourage you to give yourself at least 3 to 6 months to recover from a facelift before you do any of these important things, because that's the point where the swelling comes down and the people who know you well will see you more as yourself. I like to treat the sag first. So everybody has some degree of each of the aging things that happen. So some people, their aging is coming because they have a lot of volume loss in their face. So you can have fat grafting that goes along with your facelift to restore that volume. Or if volume is your only problem, we could do volume restoration just with commercially available fillers. I don't recommend doing only commercially available fillers because you don't want to rely on those. That's when people get that pillow face look where they look unnatural. Because if you're using volume to fix sagging, you're never going to get that natural look, because you have to really target the problem and fix it appropriately in order to get a really nice natural looking result. So when you have a volume loss, you fix with volume. When you have sagging, you correct sagging. And then when you have problems with your skin, which often come in combination with the sagging and volume loss, you do things to fix the skin. From good medical grade home care to regular facials, microneedling, laser treatments, all the way on up to more aggressive treatments like phenylcroton oil peels, which really have some remarkable effects as well. This lady represents one of my early facelifts when I was doing a SMAS plication facelift. This is her before and after following her first facelift. I did an upper and lower lid blepharoplasty, facial fat grafting, and a SMAS plication lower face and neck lift with a nice result. Here are her side and 3/4 views after the quad bleph with lower face and neck lift. Here's a representation of how that facelift aged and why I started moving toward the deep plane facelift. So here you see in these 3 pictures, the before from the beginning, the after about a year after her facelift, but then you see in her 3rd photograph is a depiction of what she looked like 5 years after her facelift, and it really didn't age as well as I like it to. You see almost a complete recurrence of her platysmal bands and the redundancy of her neck tissue. So I didn't think that that was long enough for a facelift to last, and that's when I started investigating going into deep plane facelifts. So she did come back to me about 10 years after her original facelift, and here she is in her before and after her second facelift. And in this facelift, I did a deep plane facelift. What's notable is that we have persistence in her blepharoplasty, but her lower face and neck lift really didn't hold as well after 5 years. So after this deep plane facelift, I looked at her pictures and her progression through her life, and particularly through the time that she's been visiting me as a patient. And the first picture here is 15 years ago when I first met her. The picture in the middle is about 2 years ago, so she's about 10 years after her first facelift. And then the third picture is the most recent. And what I notice about these pictures is that she appears to be aging backwards. And here she is from the side. So the picture on the left being when she is the youngest, and the picture on the right being when she's at her oldest age. And you're seeing that she's looking younger and younger in each frame. So after going on and studying deep plane facelifts with the experts around the world, I began doing deep plane facelifts over 10 years ago. And it helps a lot with these patients in particular, meaning the patients who have a little bit of a heavier lower face and neck, because a deep dissection into the central neck is really imperative to thin down that neckline. This lady is a year out from a lateral brow lift and deep plane lower face and neck lift. And what you notice is that she no longer has that obtuse cervicomental angle. Instead, she has a 90-degree angle. And with the brow lift, before she had it, there was a heaviness to that lateral brow, which is really remedied with a very nice result. And in our next patient, it gives another good representation of what the deep plane lower face and neck lift does for somebody who has a heavier neck. What you should notice in this patient is that she had very prominent submandibular glands and a lot of volume into her lower face and neck. So this picture represents 1 month out from her surgery, so she still has quite a bit of swelling going on. We did nothing to her eyes. So I also like to point out that with this deep plane method, she did get some correction of that lower lid, although we didn't do a dedicated lower lid blepharoplasty. And at this 1 month point, She already is looking great and probably feels good to go out in public to the grocery store or to dinner with her family, but her friends and people closest to her will still notice that there's something a little bit different and swollen about her. But then fast forward to a year out, and here she is in the front and three-quarter view with 1 year after surgery. And you'll notice it looks like she lost 20 pounds when actually she didn't lose any weight at all. The deep plane facelift and the thinning out of the deep structures of the central neck are what makes her have that thinner appearance. And now that all the swelling has subsided, she can enjoy this final result. Another patient who only opted to do a lower face and neck lift and nothing to her eyes or brows has a really beautiful result. And what I want to point out in this example is that she really had what we call an obtuse cervicomental angle. It looks like her chin is sort of just merging with her neck and going into her chest. What I like to do in these patients is deepen that cervicomental angle with a hyoid fasciotomy. And that means releasing the bands around the lower neck bone and deepening that cervicomental angle. So it really looks like she had a chin augmentation when she didn't at all. That result was all achieved doing the lower face and neck lift. This patient had a lateral brow lift with a lower face and neck lift and an upper lid blepharoplasty. She actually broke this procedure down into two separate procedures. We started with an upper lid blepharoplasty under local anesthesia in the office, and then she came back a year later and we did a brow lift with a lower face and neck lift, and this is the final result of both of those procedures. This is another example of a patient and a great example of when we combined great skin correction with lower face and neck lift. What you're seeing is her total before and after picture after she did a brow lift, upper and lower lid blepharoplasty, fat grafting to her face, and a deep plane lower face and neck lift. And then after a period of 6 months, she came back and did a phenol croton oil peel. And you see her results after all of that was accomplished. Here she is with a depiction of those surgeries broken up into the two different surgeries she had. So in the left-hand pictures, you see her front and side view of before. The middle pictures represent the front and side view of after just a facelift. And the thing that you will notice with this is that we've corrected the sagging, particularly in the side view. You can see that there's no longer that extra neck tissue. Instead, she has a 90-degree angle. But what you might notice, particularly in the front view, is that her skin is still full of deep crevices and imperfections that would indicate somebody who has had a lot of sun exposure and some aging on their skin. And then you go all the way over to the right-hand side after she's had the phenol croton oil peel. And what you see is the smoothing of the texture of the skin and even a little bit more tightening underneath her chin, which remedied some of the laxity that was left behind by the surgery. And she really looks like she's taken the age away from her skin, so that completes the result of the surgery. This is another example of somebody who underwent surgery and then came back 6 months later for a phenol croton oil peel. This frontal view shows a coronal brow lift where we lowered the hairline to shorten her forehead and lift her brow at the same time. And she had an upper lid blepharoplasty and a deep plane lower face and neck lift. In the center picture, you see her just after surgery, and in the picture on the right, you see her after her peel. And this is a 3/4 view of the same patient. The first picture is before any surgery or peel. The second picture is after surgery, but before the peel. The last picture is after both procedures have been done. Here she is with a full before and after. So the first picture in this is before anything was done, and the second picture was done after the facelift and croton oil peel. And here's the 3/4 view of that same patient after her facelift and croton oil peel. Next patient represents a different kind of patient who did have a brow lift, upper and lower lid blepharoplasty, facial fat grafting, upper lip lift, and a deep plane lower face and neck lift. So the surgical corrections were done, and then we have been managing her skin through the med spa gradually. So little by little, we've been doing a series of lasers which target the brown pigment and sun damage in her skin, and doing halo lasers in series to gradually get her skin quality improved after her surgery. So a little bit less downtime than you would have from a croton oil peel, but still an improvement that she's getting and maintaining through the med spa, through treatments that have a little bit less downtime. The next patient had a similar situation where she had a temporal brow lift with a deep plane lower face and neck lift. And then we came back and have been doing gradual improvements to her skin using our laser with a series of photofacials and halo laser facials to improve the texture of her skin. Again, a similar situation in a patient who had a temporal brow lift, upper lid blepharoplasty, deep plane lower face and neck lift, followed by a series of photofacials to target the sun damage in her skin, and twice a year, halo laser resurfacing to improve the quality, reduce pore size, and reduce fine lines and wrinkles without a whole lot of downtime. And then you have patients who opt to do less. This patient really didn't want to do anything to change her eyes or her brow position, but she was really bothered by the jowls and the shape of her neck. So we did a simple deep plane lower face and neck lift. And with the improvement of her jawline, she really has a very good result without doing anything else. So she can come back at any time to do anything to her brow or lids if she desires at any time in the future. And certainly we can do laser resurfacing, or if she wanted to be a little bit more aggressive, we could do a croton oil peel at any time. This patient is an example of somebody who had a lower lid blepharoplasty along with a deep plane lower face and neck lift. And we see good resolution to the hollows under her eyes and some resolution to the crepiness under her eyes, as well as the platysmal bands in the center of her neck. Is a younger patient who is just 15 days out from a temporal brow lift with lower face and neck lift. So generally people feel pretty comfortable going to the grocery store or out in public just 2 weeks after their facelift. Some people take a little bit more time to resolve the bruising, and then others look like this lady who could really get away with going out in public anywhere. I would recommend in general that people give themselves at least 3 months to fully recover before an important event or something where there'll be a lot of photographs taken. This is a patient who had a brow lift, upper lid blepharoplasty, facial fat grafting, and a deep plane lower face and neck lift. And she's 3 months out of surgery. And we even do people who are in the older age group. This is a 78-year-old lady who had a brow lift, upper and lower lid blepharoplasty, facial fat grafting, lower face and neck lift. And here she is in the side view where you could see a nice resolution of that redundant skin. We also have men who come for facelifts. This man had a deep plane lower face and neck lift. And it's very important to men to have that definition of the jawline. Not only does it infer masculinity, but also a youthful look that not only helps in the way that they feel about themselves, but sometimes helps with job opportunities. And I've had that happen from time to time. And here's another man with the same situation who had a lower face and neck lift. And then after that, he's been coming for a series of photofacials to help with the sun damage on his face and on his head. This lady underwent a temporal brow lift with a lower face and neck lift, and here's her result at 3 months. And here is a lady that is a great representation of recovery. This picture represents 1 month post-op after a brow lift, upper lid blepharoplasty, and lower face and neck lift, and she already looks great at 1 month. And here she is after over a year of recovery with great resolution of all the swelling, all of the sequelae of aging, and also a nice enduring result that will take her in the next 5 to 10 years. This will give you a good representation of what we do at the Collins Center of Plastic Surgery and Aesthetic Medicine. We have a lot to offer in facial aging. This is certainly just the beginning of the conversation, and everybody is different. So come in and have a consultation, and we'll talk about your specific needs and tailor particular needs to accommodate your goals.